MRIs that are now going viral on social media show that this filler actually never goes away.
This is Dr. BBT. He's one of our plastic surgeons, and I'm an aesthetic nurse injector, and we have a correction clinic here at Dr. Perlman's office in New York City, and we see this a lot. It is pillow face from too many filler injections, and yes, we have been in trainings where we have been told that it only lasts a year, but when we are in practice, we see otherwise, so we're very careful with our fillers. One thing that we collaborate very closely here in the office is when it's time for surgery and when you just can't be doing a ton of filler. So that's one misconception, is that filler will lift, and filler will not lift. Filler might support a structure for a little bit, but it won't lift, correctly?
Absolutely right. And so a lot of times people are convinced that the filler will give them a lifting effect. The only thing that really will lift is a facelift, and that's surgery. Fillers can help correct deficiencies like volume deficiencies, whether it's your lips, cheeks, chin, whatever, but it's not going to lift anything as much as surgery will. So keep that in mind.
Also, if you're young, you can hold a lot of filler because your skin is nice and tight. It recoils and it's got this nice little tightness to it. But as you get older, if you've had all that filler and it's not going away with time, and if you're closer to like your 30s and then you're in your mid 30s and you've had filler every year, with time your skin is going to get thinner, correct? As we age.
That's a fact.
It's normal with your hormones, it's normal with aging. So with time, you are going to start expanding all that filler, and it's not going to look the way you did in your 20s. So be very careful if you're young, if you're a young millennial, a Gen Z, be very careful with how much filler you place in areas, and don't try to overcorrect something to make it look that it's not, because that's where you get into issues.
One area in particular is under the eye, or the tear trough area. Putting filler there can be problematic because it can migrate. It can disrupt the lymphatics in that area, because the lymphatics is very important to prevent edema or swelling in that area, and that could be a common problem. And so nowadays, I don't even like injecting HA fillers or typical fillers there. Instead, we like to use our own blood, PRF, or PRF gel if you want a little bit of volume. And it not only helps with the skin quality and texture, but if you use the PRF gel, it can help with small volume deficiencies. And then if you have a big deficiency or a big hollow, then you might be a candidate for surgery. And that could be either a blepharoplasty with fat repositioning or fat grafting, depending on what you need.
Yeah, so take care of your skin, take care of your lips, your cheeks, anything where you don't want to overcorrect. It might look nice for a little bit, but in the long run, you will pull a lot of water in. Depending on some of these fillers, they can pull up liters of water into your face. And if you're young, the water can hold, and if you're older, as time changes, it will not hold, and it will be very evident, especially when you're dynamic movement and showing expression. So take care of yourself and be careful out there.
Take care.